Hi there, welcome back, and we're with Dr. Bilski. And Dr. Bilski, I'm gonna have a confession to make. And I know you're gonna be shocked, but I'm a big popcorn eater, man. And I make it the old-fashioned way. And
our favorite patients are popcorn eaters.
Well, okay, then you know what I'm gonna talk about, because when the good fluffy stuff is gone, I still take the kernels and pop it. And I know it's stupid, and I do it. And I haven't cracked a tooth yet doing it, but perhaps we can talk about cracked teeth and...
Yeah, so the terminology in dental is called cracked tooth syndrome. Okay.
That sounds even scarier than eating popcorn kernels.
Definitely sci-fi for sure with the syndrome, right? It's not Ebola virus or any other stuff that's going on. What it means is we use terms like virgin tooth, meaning there's no cavity, no filling, all right? And in this example, say you're biting into that kernel that's remaining on the bottom of the bowl, and you bite down, all of a sudden you get, oh, wow. But then it kind of goes away, okay? Then you got done cutting the grass in one of our bits that we talked about, and you have that water. Holy, your eye curls back into your head, and you're like, holy smokes, that hurt. And then it goes away. Then you have, say you like chocolate, it's Halloween, you grab one and then you put that Tootsie Roll in there and the sweetness.
Yeah, sweetness like, sometimes.
Whoa, what's going on? And it lingers, okay? Or then it's February and you're out shoveling snow or you clean off your car, take a sip of your coffee, and you're like, ow.
That hurt too.
And then you breathe in, you're like, oh. You're getting hit from both sides. That's cracked tooth syndrome.
Okay.
What that means is the tooth is cracked and it's probably communicating with the dental nerve. Doesn't necessarily mean you need a root canal, but it is an alert that your doctor should be saying, Randy, you ate the popcorn kernel. You know you're not supposed to eat the kernels. This is what happens. I'll give you a bunch of examples of what happens and why it happens. But what we need to do for you is I'm going to recommend a crown to be placed on that tooth. And on that tooth, I'm just going to put a temporary crown, sometimes called treatment crown, or provisional, because the process that we're trying to is rule out a need for a root canal, okay? Now, you'll wear that for maybe 3 or 4 weeks, that temporary or treatment crown. Then you come back in, I said, well, Randy, before I numb you up, how's it feeling? Can you eat with that side? Yes, I can. Does hot and or cold bother you? No, it doesn't. Okay. What about when you breathe in air? Did you try a Tootsie Roll lately? You know, all the things you would have told me about before. Sure. Doc, everything's cool. So in our office, we get you numb, pop the temporary, the treatment crown, and because we have a lot of technology, it's called a CEREC machine. We'll image or take pictures of your upper and lower jaw, make the crown in our office with a CNC machine.
Oh, wow, pretty neat.
On your tooth, that day you're out of here, no root canal.
No kidding.
Okay?
Wow.
The other way around that is we went through the whole thing. I put the treatment crown on, the provisional crown, and you call me like 2 days later.
Ain't working.
Like, oh my. All right, Randy, I got 11 o'clock this morning, or I can see you at 3. What do you want to do?
11.
Pretty much, I know where you're gonna probably come early.
Yeah.
But, so we do the root canal, and if we have additional time, we'll actually image or scan the tooth, and then make the crown that same day. And then we want to be done.
Yeah.
So that's cracked tooth syndrome. So the symptoms are sensitivity to percussion, which means tapping, chewing, air, sweet, hot, cold. I'm sure I'm missing something, but there's 6 things right there. And we handle them a little bit more conservatively, unless I've had a history with you of doing this already. And every time we do a big filling or a crown, you come back with a toothache.
There's a pattern there.
There's definitely a pattern, and I have plenty of patients, and they even alert me now, like, hey, doc, I know you're going to tell me that I don't need a root canal, but would you please? And that's called good dentistry, that a patient requesting that under the guidance of a dentist, explaining like, yeah, that makes sense. In most cases, another underutilized service that probably should be presented to you on any situation, but particularly in this case, we temporize the tooth with mild symptoms, let you wear it for about a month, bring you back, I'm fine, make the crown. If it's not fine, we do the root canal.
Well, it all makes sense. That's what I like about it too. And it's, even that little test time is like, do I need this or don't I need this?
Yeah,
that just makes sense.
It just makes sense for sure. That's the best way.
What doesn't make sense is me continuing to eat popcorn and popping those kernels. And I know I probably kind of still will, but at least I know I can be taken care of, okay? Does that make my decision to eat kernels a little more rational?
If I had 1,000 Randys, I would be retired.
Okay. Hey, thanks again for all the information as usual.
You're welcome. Yeah.